Happy Friday. I'm Nancy Levesque, Communications Director for the Future of Privacy Forum. Welcome to this week's Privacy Chat. Today, we're talking with FPF experts Dr. Rachele Hendricks-Sturrup, Health Policy Counsel, and Senior Fellow Zoe Strickland, who's actually new to the FPF team, so we're welcoming her today. We're talking about health privacy, everything from digital contact tracing to HIPAA and vaccine passports. With that, I'll hand it over to FPF CEO Jules Polonetsky. It's all yours, Jules.
Thanks, Nancy, for kicking us off here, and thanks to those of you who are interrupting your day or ending your day, beginning your day. I don't know. We are doing a lot in the Asia Pacific recently, and so I think we are growing our audience and our activities there as we become active in Singapore. We just added a senior fellow in India. So wherever you are, thanks for hanging out with us. We're going to chat for about half an hour, as we do. Very informally, no panels here. You're all welcome to be part of the discussion if you're watching and listening. So do post. I'll pull your comment in and we'll respond to it. If you say something witty, that is, or just share your opinion and share it with everybody else here. Super excited to have both Rachele and Zoe with me. Let me start with Zoe because, as Nancy mentioned, Zoe's newer, but not actually so new, because Zoe has played senior executive roles in privacy and more broadly at organizations from the United States Postal Service, which is, I think, where I first met her in the really early days of IAPP and privacy organizations. Postal Service was one of the early agencies to designate a role like that. From there to Walmart, United Healthcare, JP Morgan, most recently Cigna, and today we're super happy that she's spending time as a senior fellow as opposed to a advisory board member and a friend and a colleague to help add some of her experience to the work of our teams. So I listed a bunch of brands that probably everybody knows, probably everybody does business with them, recognizes them, globally, perhaps. How have you had this career where, one prominent role from a Walmart to a United Healthcare to JP Morgan, were you speaking on lots of panels? We're on LinkedIn here. People are interested in career development, how to advance, how to get the next job. What's been your secret, or what came into place that just took you from one, Fortune 500, Fortune 100, maybe even Fortune 50, maybe organization to another?
And not to mention FPF as a big brand name. I have been really blessed, and I think people who are doing privacy, what a fascinating field. It has been for the last 20, 30 years, and I expect it will for the next 20 or 30 or and beyond. It's just central to ourselves and who we are and how we relate to employers and society and each other. So I would just say for each of these roles, I was recruited, and I do think that there is a group of professionals who have the circuit in terms of privacy, and there's more supply. So I do think it's good to keep yourself out there, stay engaged, definitely IAPP, FPF, make sure that you're engaged in the privacy sphere. And I do think that for recruiters and companies, the role, they're very really deeply interested and concerned, bring a lot of energy and smarts to the position, and very welcome. Anyone who wants to reach out to me with any further thoughts they might have. But I've loved it. I love big companies. I love how this particular field has evolved and continues to evolve. I would just recommend to people to keep continuing on their path to make their career what they would like it to be.
So let me ask you this. Recruiters are how LinkedIn makes its money. I mean, there's some ads here, but LinkedIn makes this audience, people watching us, people registered here. I mean, that's who pays for LinkedIn. And I always get pinged by recruiters. How how much did the recruiting come to you via, LinkedIn, or, at your senior tier, there are obviously a collection of, executive headhunter types. Was LinkedIn and LinkedIn recruiting part of how any of these folks sort of found you or reached out?
I think it's a mix. I definitely think that they're looking at LinkedIn and they're doing title searches and things like that. I think that definitely happens. I also think there's word of mouth. So I think it's a combination of how you get your name out there.
So one more thought before I bring in Rachel. I described you both as health experts, and Rachel, you'll hear in a bit, comes from the research background. You were on the payer side, right? I'm still learning some of the industry sector sort of terminology. So Cigna was a health insurance provider, right? And United Healthcare, but both sort of similar. Cigna a bit different. What to many who are perhaps coming to this from different aspects of health and regulation, the payers think about it in a very specific way, right? In terms of the kind of data they get, and give us a flavor of what does it mean on the regulatory side to be on the payer of this sector. And by the way, for the international folks, maybe you don't care about this because you get healthcare and your government pays for it. And maybe some of you have sort of mixed models, but as you all know, if you watch the Harry and Meghan thing and you saw all of our ads, we pay for our healthcare, or we pay insurers, or our employer pays an insurer, and it's a huge part of our economy and part of our regulatory structure.
Okay, so at the simplest level, and I'm definitely turn over to Rachel as a deep expert here. Payers are health insurance providers, and then
Zoe's internet freezing up a little. Let's see.
Companies, medical devices, things like that. But that's the simplest level. There's payers, there's providers, and then there's sort of this tech, mobile device.
We will come back to Zoe because she's freezing up a bit. Rachel, let me have you jump in, and maybe people probably be interested in hearing a bit about one area that you are leading work for us at FPF now. We all know that in the US, we've had this division between regulated health, HIPAA primarily, well known as the federal law that sets the rules, and then everything else general, covered by consumer protection law, with exceptions. It might be captured under credit or employee and so forth. But, the general, what happens with your wearable device if a health insurer or a medical provider isn't involved. And now we've got lots of regulation, and we're regulating health, much like other parts of the world. But all of a sudden, we need to figure out what that word means. So
yeah,
bring in there.
Yeah, so I like the examples that you just mentioned. The big question is, actually, there's two big questions, to the point you raised. The first big question is, where does HIPAA start and where does it stop in terms of health information privacy, whether on the consumer side or the HIPAA covered entity or healthcare provider or payer side? And then the second question is that I think Zoe was starting to allude to, is that when is something considered a medical device by the FDA?
And where does it stop in terms of
who would be the main regulator to make that determination? Now we are seeing a lot of consumer wearables or consumer level devices have an ability to connect with electronic health records like Fitbit, those sorts of fitness type of tools. And they connect with EHRs in a way that allow healthcare providers to ascertain one's health behavior and thus healthcare outcomes potentially and so forth. So, again, the questions are raised, to what extent do I as a consumer receive adequate privacy protections when I authorize or maybe not authorize my consumer-generated health data to become part of my electronic health record, or even in reverse, when I allow my electronic health record to become part of my consumer data profile in the event I can access my records myself and share them independently. So there's this really broadening, blurry line around what I call the patient-consumer spectrum. I've talked a bit about this in some presentations at FPF before, and the question remains. And I think it's something that we are going to be sorting out for a while. And it's something that is going to become increasingly complex, especially as new regulations roll out, like the new interoperability rules under the 21st Century Cures Act.
So go ahead, sorry.
One thing that's about this that is particularly, I'm going to use the word fascinating, or problematic, which is when you have a set of rules that are understandably trying to figure out what do we do to make the playing field more understandable, more even when you're dealing with more sensitive information. But you end up with a situation where people who we're trying to protect get a different set of regulations from their healthcare companies and their non-healthcare companies, different notices, different rights, very confusing, right? So I think there's that aspect too, besides the how do we understand it and comply, how on earth is this being understood by the consumer base?
Where I'm struggling, and I think this is going to be high on the radar of many people in legal and compliance, is we now have laws, right? The CPRA, the California law, says that there are additional protections, a certain sort of opt-out of secondary use, for example, for sensitive data. And one of those is called health condition. And I think we know that you can ascertain my health condition from my loyalty card and my shopping, my smart scale, my Fitbit, my, I don't know, my zip code, right? For better or worse, you know, your geography is destiny, as unfortunately we've seen. My ethnicity, right? All this information is deeply revealing of health. But is it therefore now regulated as health data, right? That would make the regulation sort of meaningless if it just swept up everything. So Rachel and our team are doing, I think, what is really important work, trying to come up with a logical line to draw between, I don't know, maybe I took 100 steps with my Fitbit. Is that really health data? But is some use of that over time for certain sorts of purposes then going to be captured? So really, I think going to be a bigger issue than many appreciate. The California AG, or now the new data protection agency, that has just had some board appointees put in place, and we'll have to hire an executive director and really get geared up. I assume will give us rules at some point, but it would be nice for all of us who work in the areas of this sector to come up with some ideas. Now the good thing is that the California law does carve out data when it has been collected for a different purpose and is only incidentally something that might be used for health. So my loyalty card, right? If the point of my loyalty card is just to give me, discounts or to market, to me or learn whether or not it's true that the people who buy, diapers also buy beer at the same time, and you should put the supermarket together. I mean, that may indicate that, there's a pregnancy, right? Or a baby, in the house. But if it's not being used, if it's incidental, and that's not the purpose, so the California law at least did carve that out. But Virginia also has a definition. Theirs focuses more, if I'm right, Rachel, on things like diagnosis. Is that only a medical diagnosis at a doctor? I mean, I don't know if I use one of these apps. I was playing the other day with one of these, AI apps where you put in your symptoms and then it says, here's what you might have. Is that a diagnosis? Kind of, right? I mean, maybe that ought to be captured, even though it may not be, a traditional medical diagnosis. Let's switch to a different topic, contact tracing. And this is another one where Rachel's really been doing a lot of interesting work. It seemed like we were all debating contact tracing, a few months ago, when it seemed like we would have such a thing in the US. And many of you know, I guess we have it, but we just seem to, we don't lock down a lot, and it seems to be spreading. And we don't seem to be deeply focused on the contact tracing as big a part of the measure. But presumably, as we get a little bit more control and the vaccination rolls out, and we start seeing that, hey, the disease is still spreading, and we can start isolating, we'll probably turn back to that as a source of debate. But a lot of challenges. How do you deal with some of the issues? And Rachel, jump in on that.
Sure thing. So digital contact tracing was a novelty at the start of the pandemic last year, as you mentioned. And, contact tracing in general is obviously not a new thing. It can be done manually. It has been done manually by public health authorities and others for a long time, tens of years. And with it becoming digitized, now that there are technologies available to make that happen, like the Google Apple API, for example, every state, or at least many states, have built their own apps using this API. And some people have downloaded it, some haven't. Where I live here in Virginia, there's the COVID-Wise app. And I have downloaded it, but I haven't yet to actually receive any notifications. So it makes me wonder, are folks just not using it, or have I just really been social distancing properly? I don't know. But the bottom line is that in order for someone to use this particular app, they have to have a smartphone that would allow the app to be downloaded. B, they'd have to feel comfortable enabling its functions. And then C, they would have to understand that the app is only as effective as, or to the extent that other people are using it as well. So it might be meaningless or pointless if I'm the only person in the room of, hundreds of people, which is probably not a good idea to do right now anyway with social distancing requirements, but I'm the only person with the app. So, there's a lot of variables here that would determine or dictate its efficacy or its utility. And right now, I just feel like there's way too many variables and factors that might right now prohibit its ability to become, demonstrated in an efficacious way. There are too many barriers in place. And I think, we're starting to realize as a society that, the rollout of these apps might be premature, but that's not to say that, we're gaining traction at this point in time with regard to, starting at ground zero with developing these apps and improving them further, and also increasing public trust in them as well. And then another thing that's of the utmost importance around these apps is, as I mentioned, trust. Do I trust it enough to use it? Do you trust it enough to use it? Do your family and friends trust it? And the people who have built it, if data is being collected or aggregated somewhere, do they trust those data aggregators, whoever that might be, whether private or a public entity? And how are they going to use this data? How does this affect me? And even as some populations might not want to social distance because they can't do it, they need help, or because their mental health is suffering. These are some really serious ethical and social, type of questions to ask about these apps as well. We can't just assume in a vacuum that everyone will want to or can social distance in the event their app pings them and tells them that they should. And that's, again, even if the app is being effective in the first place. So again,
Chloe, have you downloaded one of those contact tracing? Actually, I guess they're not calling them contact tracing now, right? It's more exposure notification, right? Because it's not really contact tracing. Have you downloaded one of those, or would you use one of them?
So I almost did. That's my answer, because we're so far along at this point. I will say this, to the point about contact tracing already being around. My son is in middle school, and the non-digitized contact tracing is very slow. I mean, they'll tell us several days later. He's in a hybrid situation, and one of the fellow moms, she heard like 10 days later that her son might have been exposed near the quarantine rules. It's like quarantine was almost over at that point. There are some, obviously, for things being faster and more automated. But I think that this is an example that has all the privacy issues in spades. I mean, secondary uses was a big thing we wrestled with at companies. Once you have the data, what else can you do with it? And that's when employers or companies wanted to also get an understanding of people coming back. And then where are you storing it? Who has access to it? Can you force people to do it if they don't want to? So, and it's another, besides the fact of these very important issues to people, it was also coming along really fast. In privacy, we rely a lot on industry standards developing over time, and there wasn't much time to do that because it was a pandemic, and it was like, what are we doing? How do we collect the data? How do we use it? And, both the moral and legal issues were not settled.
Well, I've got one. It's never pinged or done anything, so I don't know how useful it's turning out to be. But, my calculation, was the actual contact tracing today, between the delays that it takes, but people don't answer their cell phone. People don't answer their phones anymore. And, in an ideal world, if the government was doing it and everybody could be contacted and, someone would like knock on your door or I don't know, send you a message or something. But I kind of compare the imperfect system we have today, where even in the areas where they've had a real professional workforce and have done a lot of work to support contact tracers, they're finding that very few people will answer their phone. So, if their phone pings them because they've downloaded the app and it says, hey, you've been exposed, like go get tested at least or something, right? I mean, hopefully we'll have rapid testing by then, I hope, right? Go get tested, right? Or I don't know, if you're living with somebody vulnerable or something like that, who couldn't get a vaccine because they're in a high risk, category, and so you're trying to be careful. Don't go in that room with them, right? Because you could take questions. I do recognize, and this is why we try to have a smart, diverse team of people with different backgrounds, different experiences in life. I'm saying, sure, I will, as a straight, white, married male with a big career, behind them, and I'm the CEO, right? So not going to be fired by my boss. So it's one thing for me to be like, sure, I'll do it, right? I think those of us who are helping, shape the rules need to say, well, wait a second, how does it affect people who are employees? How does it affect people who come, from disadvantaged groups? How does it affect people who worry that, there'll be a penalty or they'll have to lose their job or, all of the different equities. So discount my opinion, but at the end of the day, it may be as much of a equity and a sort of fairness issue as it is, do we have the right privacy rules in place? All right, one more topic. And folks, if you're listening, I'm keeping an eye on the comments. Do feel free to jump in and we'll see if we can squeeze it in. The other big issue in the news seems to be vaccine passports. On one hand, we kind of always got some card that said we were vaccinated. Those who travel around the world know that you need it to, get into certain countries where you got to have the right shots. Those of us with, kids in school know or camp, like that drives me crazy. Every year I got to, show 5 different summer camps, 16 different forms. I'm like, could there be one thing where like you could just know that my kid is up on their shots? It's a giant hassle. I've kind of begged for that convenience, but all of a sudden this is a little bit different. So I'll turn to either of you to sort of jump in on, what are you thinking about the fact that, the Europeans have just said the European Commission has kicked off a process to create such a passport. Israel's already using sort of a green passport, a green card of sorts. I think President Biden has asked the ONC at HHS to begin work on this. What are your thoughts on vaccine passports?
Mm-hmm. Yeah, so I always think about vaccine passports in the way you just mentioned, where for a long time we've had to show our vaccine records in some way, usually a paper we have to get from the doctor and physically pick up and bring in. Now that's sort of elevated or evolved rather into us being able to log into our patient portals and pull the information from there in the form of a PDF that we can just simply show on our phones or something like that, or even print if we need to. But now I think what COVID-19 has introduced is the concept of a vaccine passport or a digital vaccine passport, where we can sort of centralize all of our vaccine records into one place, whether it's a patient portal app or something different offered by a third party, and use that as a way to sort of get access to not just travel, but other types of public and private services. So it seems like the concept of vaccine passports has not only evolved from a technology standpoint, but also from a social standpoint, in that this is something that might become commonplace in society for us to just do simple things like visit a museum, access services like staying at hotels or something like that. It just seems like it's just getting broad and arguably overreaching to some people who, might feel like it's just too much and a little overblown. So there's, those are two things to consider, again, from the technology side and from the social side. And my concern is that, as these vaccine passports become digitized and can, in one place house all of our information, which could be convenient, obviously in a lot of ways, especially for people with little kids like me who also participate in activities. But again, is this a point of no return? Like, where this is going to be the new way of us showing that we're healthy enough to show up to certain places and participate and gain access to various places, and who's going to require it and why? Arguably for international travel, that's fine, but just for day-to-day stuff, where does it stop and start in terms of, using or leveraging these passports in just day-to-day, daily activity type of ways?
And one issue seems like when also, right? Because like right now, much of the world doesn't have access. Much of, I haven't had access yet. I've got a child who hasn't, one has, right? Like it feels like it would be deeply inequitable if some people could travel and some couldn't. I think at some later point where everyone can and should, and some people can't, maybe because of a health issue, or won't because of a ideology or the like. And when you're then talking about, do you go to school or do you go into certain, zones? Maybe you have to take a rapid test if you aren't able to. And if you are able to show that you are up to date, then maybe you don't. But at least we're not, preventing you from ease of access. I don't know, Zoe. What do you make of vaccine passports?
Jules, you touched on something that I think is highly relevant, which is how privacy is getting into other social issues too, and fairness and equity, and how AI, machine learning function and can impact people. And I often give the example in privacy, we like to talk about the benefits of a particular technology or product or new procedure that's going on. And I think a very fair point is, let's say even though those benefits are true, are there some people who aren't taking advantage of those benefits? So that even in the benefit side of the house, you got to think about who's getting impacted. And I think there's going to be more convergence of privacy with some of these societal issues.
Super. Well, we are approaching the top of the hour. So those of you who are at work have got work to do. And those of you who are starting the weekend should be uncorking your favorite beverage. So let me thank Zoe and Rachel for joining me. And thanks to all of you. We'll keep an eye on the comments. If you jump in with anything afterwards, we'll respond if it's interesting, or just to say hi. So thanks all. Have a great weekend, everybody. For those who are celebrating Passover like me next week, best wishes for a great holiday, and see you all soon. Tune in next week. We'll talk about something interesting. We'll let you know what it is. But Friday, probably just around this time. Bye, everybody.